What should I do, Ms. Xiaorong? My mom has small thyroid nodules.
Don't worry. Thyroid nodules are quite common. The palpation method has about 4% detection rate, while ultrasound scans is between 20% to 50%. Women have 3 times the risk compared to men. Ultrasound with physical examination can increase the detection rate of thyroid nodules. 80% to 90% nodules are benign, and less than 10% is malignant. A needle biopsy can be done to confirm, only if a malignant nodule is suspected.
Ms. Xiaorong, can benign thyroid nodules become cancerous?
Benign nodules are divided into nodular goiter and thyroid tumors. Benign nodules may become cancerous, but the probability of it happening is less than 5%. While benign nodules don't affect thyroid functions, scans should be done every 1 to 2 years. Annual scans should be done for low-risk nodules as they can still progress to cancer. Medication is ineffective for benign thyroid nodules, while surgery is risky due to partial thyroid removal. Not only the patient may have to take medication for life, post-surgery scars will be visible too.
I see. But my mom cares a lot about her looks. Ms. Xiaorong, is there any other form of treatment?
If the thyroid nodule is benign, and the nodule doesn't affect the trachea or thyroid function, the microwave ablation treatment is a minimally invasive, non-surgical treatment for thyroid nodules. The first step is locating the nodule using ultrasound. Local anesthesia is given to numb the area, and a 1 mm microwave needle is inserted through the skin. Microwave energy is then released to treat the nodule. Ultrasound guides the procedure with real-time outcome monitoring. After the treatment, the burnt and necrotic nodules will be slowly absorbed by the body.
A microwave needle smaller than 1 mm. Does that mean the wound will be very small?
Yes, the microwave ablation for thyroid nodules is minimally invasive, scar-free, quick, and has low complication risks, with only 12 hours of post-treatment observation.
Okay, I'll go home right now and discuss it with Mom. Thanks, Ms. Xiaorong.
You're welcome. I hope your mother gets well soon.